Leukemia is the name we give to cancers that begin in the body's blood-forming tissues, places like the bone marrow and the lymphatic system. Exactly which type of leukemia a person has depends on which blood cells are affected and on how quickly the disease develops. Though it can strike anyone, it is most often seen in adults over the age of 55. At the same time, it's also the most common cancer in children under 15, making it a disease that spans generations. In its earliest stages, leukemia can be a quiet, creeping intruder. The symptoms vary depending on the type, but they often begin subtly. A persistent fatigue that no amount of rest can fix, fevers or chills that appear without explanation, infections that seem unusually frequent or severe. Some people start losing weight without trying, swollen lymph nodes, an enlarged liver or spleen, unexplained bruises, recurring nosebleeds, tiny pinpoint red spots on the skin, night sweats, or even deep aches in the bones. Each of these can be a signal that something is going very wrong in the blood. But why does leukemia happen at all? Scientists still don't have every answer, but they know it begins when certain blood cells undergo changes in their DNA. DNA is the cell's instruction manual, telling it when to grow, how to function, and when to die. In leukemia, these instructions get scrambled. The mutated cells don't obey the normal stop signals, they just keep multiplying, and they don't die when they should. Over time, these abnormal cells crowd the bone marrow, leaving less room for healthy white blood cells, red blood cells, and platelets. This shortage is what causes many of the symptoms. The immune system falters, oxygen transport suffers, and clotting becomes difficult. Doctors classify leukemia in two different ways: by how fast it progresses and by the type of white blood cell involved. Acute leukemia strikes with speed. Its abnormal cells are immature, unable to function properly, and they multiply at a rapid pace. Without timely aggressive treatment, it worsens quickly. Chronic leukemia, in contrast, involves more mature cells that can function normally for a while. These cells accumulate slowly, and the disease may go unnoticed for years. Then there's the question of which white blood cells are involved. In lymphocytic leukemia, the cancer targets lymphocyte cells that help make up the immune system. In myelogenous leukemia, the target is the myeloid cells, which give rise to red blood cells, some types of white cells, and platelets. From these two ways of classifying, we get the four major types: acute lymphocytic leukemia, all A; acute myelogenous leukemia, all A; chronic lymphocytic leukemia, all A; and chronic myelogenous leukemia. AML affects both children and adults, while ALL is most common in children, though it can appear in adults too. CML mostly affects adults, and CLL is primarily seen in people over 55. Beyond these, there are rarer forms, like hairy cell leukemia, myelodysplastic syndromes, and myeloproliferative disorders. Some people face higher risks: prior cancer treatments, genetic disorders, certain chemical exposures like benzene, smoking, and a family history of leukemia all increase the odds. But having a risk factor doesn't guarantee the disease will appear, just as lacking one doesn't offer complete protection. When leukemia is suspected, doctors begin with a physical exam, searching for telltale signs like pale skin, swollen lymph nodes, or an enlarged liver and spleen. Blood tests can reveal abnormal counts of red or white cells, hinting at trouble, but sometimes the cancer cells hide away in the bone marrow and don't show up in the bloodstream. In that case, the next step is a bone marrow biopsy. A thin needle draws a sample from the hip bone, which is then examined under a microscope. Specialized tests can analyze the leukemia cells themselves, revealing details that help guide treatment choices. Treatment depends on many factors: the patient's age, overall health, the exact type of leukemia, and whether it has spread. Chemotherapy remains the mainstay, using powerful drugs sometimes alone, sometimes in combination to kill leukemia cells. These drugs might be taken as pills or delivered through a vein. For some patients, targeted therapy is an option, using drugs that home in on specific weaknesses in the cancer cells, blocking the processes they need to survive. Radiation therapy can also be used, directing high-energy beams at the cancer to damage its DNA and halt its growth. Sometimes radiation targets a specific area, other times it's applied to the whole body, often as preparation for a bone marrow transplant. A bone marrow or stem cell transplant aims to replace the damaged marrow with healthy stem cells capable of regenerating normal blood production. Before the transplant, patients receive high doses of chemotherapy or radiation to wipe out the cancerous marrow. The new stem cells, either from a donor or the patient's own previously collected supply, are then infused, seeding the growth of healthy marrow. In recent years, immunotherapy has emerged as a powerful new ally, helping the immune system recognize and attack cancer cells that once hid in plain sight. One remarkable form, called CAR T cell therapy, involves taking a patient's own immune T cells, genetically engineering them to hunt down leukemia, and infusing them back into the body to wage a highly targeted war. From traditional chemotherapy to the cutting edge of immune engineering, the battle against leukemia has evolved into a blend of science, strategy, and hope. And while not every case can be cured, advances in treatment have given countless patients more time, better quality of life, and in many cases, complete remission.